Hi everyone. Today I would like to show the rapid urease test method for the H. pylori, that is Helicobacter pylori. Helicobacter pylori is a gram negative spiral shaped bacterium that colonizes the gastric mucosa and strongly associated with chronic gastritis, peptic ulcers, which include gastric ulcer, duodenal ulcer, and gastric carcinoma, malt lymphoma. H. pylori produce a large amount of urease enzyme, which catalyze the hydrolysis of urea into ammonia and carbon dioxide. The ammonia, which is released due to the hydrolysis of urea, it increases the pH of the surrounding medium. Hence, the gastric pH will increase, the acidic atmosphere which is present in the stomach, it will get altered into alkaline. Hence, this will help the survival of H. pylori. This is how the H. pylori, Helicobacter pylori survive even in the acidic media like in the stomach. In this video you can see this is a areotic test kit. A small bit piece of the stomach mucosa is taken commonly from the antrum and the body of the stomach, which is placed on the areotic test kit, and it is observed for change in color. If it has the H. pylori which alter or which act on the urea which is present on this kit, and it hydrolyzes the urea into ammonia and the carbon dioxide. The presence of ammonia will alter the pH of the media, and hence the yellow color which was present previously, it is getting turning into red. The ammonia releases increase the pH in the surrounding media. The indicator dye in the medium change its color from yellow to the pink or red due to the pH change. See, this reading has to be taken at the interval of 15 to 30 minutes, 1 hour, 3 hour and 24 hours. See, I get most of the questions regarding this timing. See, so I would like to clear that if it comes positive on the first reading, that is 15 to 30 minutes, or else within an hour you can take. So, that is an indication that the person is having heavy infection, means high amount of colonization of the organisms. If it comes within 3 hours, if the yellow color changes its into red or pink within 3 hours, then it is a moderate infection. So, if it changes its color within 24 hours, then it is a light infection or the very low grade infection. See, the reading has to be completed within an hour only, because in Indian population 80% of the Indian population is having the H. pylori infection. It does not mean that all the people who are having the H. pylori or Helicobacter pylori infection, they need to have treatment, nothing like that. So, only the heavy or high amount of colonization need to be addressed, or else the person is having any symptomatology related to the H. pylori, then only he need to be addressed. Hence, most of the doctors they take the reading within an hour. So, if the patient is having symptoms and the reading comes positive after 3 means within the 3 hours also, that even as I told, it is within a moderate infection also, then only it need to be addressed. If he has a symptoms, if he has no symptoms, so if it turn red or pink after 3 hours, that is a low grade infection, or within 24 hours, that is a low grade infection, then most of the time it no need to be, it does not need any treatment. And many people ask, sir, means this kit has turned red after 24 hours, after 2 days, like that. So, this may not be because of the H. pylori. Some other organisms also releases the urea. Those are the slow releasers, means slow ammonia releasers or slow hydrolyzers. So, that may be not because of H. pylori. This test has sensitivity of 90 to 95% and specificity of 95 to 100%. See, there are many factors which are affecting on this test. If the person has recently consumed antibiotic, bismuth, PPI, proton pump inhibitors like pantoprazole, rabeprazole, esomeprazole, etc., which are used to treat the hyperacidity. These things like antibiotic, bismuth, PPI, these will reduce the bacterial load. Hence, a strong infection may show as the moderate infection, or moderate infection may show as the low infection, low colonization. We, rather than infection, we use the word colonization: high colonization, moderate colonization and low colonization. If the high colonization, this change in color is observed within 10 minutes to 15 minutes or 30 minutes or within an hour. If it is a moderate colonization, then it is within 3 hours, and if it is low colonization, this change in color may be observed within 24 hours, or anything after 24 hours is not related to the H. pylori. And GI bleeding also alter the test. Patchy distribution of the H. pylori. Sometimes all the all the mucosa of the stomach will not be affected. There are sometimes what happens, only a patch of gastric mucosa is having the colonization of H. pylori. So, in those conditions, if we take the biopsy or tissue from the other sides, non patchy areas, then what happens, that may show is a negative, but usually the patient will be having the H. pylori infection. So, while taking the tissue for the H. pylori, usually doctors will take a inflamed tissue from the inflamed area or the patchy area only. And do not read as too early, like within a 5 minutes do not read the test. Here you can see is a continuous video I am doing in a patient of inflamed gastric mucosa and thickened edematous gastric mucosa. Here you can observe a change in color from yellow to pink and later on into the red. So, it is almost uninterrupted video I did just to solve the few of doubts which the audience are arising. So, this is about the RUT test kit. So, once again I would like to repeat that. So, many people ask regarding the duration. See, most of the doctors read this RUT test kit within an hour only, within an hour. So, anything after 1 hour they consider it as a moderate colonization or the low colonization. So, if the patient is having symptom, irrespective of positivity and negativity of the RUT, sometimes they put the H. pylori treatment regimen only. And still, if you have any doubts, then please write in the comment box. I will try to answer it. Thanks for watching the video. Thank you one and all.